Welcome to WRPB and WRPB Studios. As you can see, there's a big change in the backdrop because it's not mine. And as you can see, the intro is different because it's not mine. And as you can see, I kind of gave a little legway here for myself to put my own mug back up there. But with me is Dr. Ira Pearlstine. Hey, Doc.
Hey, good morning.
Okay, so he came on board to do his own videos and podcasts. And what you're looking at now is his background and his title and the name of his show. But I just wanted you guys to kind of meet him through me and through my show and let you know what's coming. So you're about to do Preserve Health Talks?
Preserve Health Talks.
And what is it?
Preserve Health Talks are common and novel problems in medicine. It's an update in medical care on the Treasure Coast. And we will try to answer burning questions people have on current healthcare issues.
So what I know, which is very little,
No, you know.
otherwise I'd be a doctor. Otherwise I wouldn't be sitting here. I'd be.
Well, you can play one on TV.
Yeah, I can play one on TV. So you decide to do this podcast and stuff to disseminate information to help people out.
Correct.
Okay. And guys who know me for a long time know that I dealt with a doc who was concierge doc like you.
Correct.
And I learned so much about the care that you get from running to your doctor, your regular doctor, and being like a revolving door to using a doctor like there was when I was younger. I don't know that most doctors don't even know probably what a tongue depressor is anymore because they don't pull them out. They don't look in your ears. They don't look down your mouth anymore.
They don't examine you.
They don't do anything. No, they sit at the computer and just write up everything. What's the difference in the practice that you do, which you're going to be telling people about in the future?
That's a very good question, and I'd love to answer that for you. So they're regular doctors, and then there are irregular doctors. And I'm an irregular doctor, okay?
Okay.
So here's the thing. About 10 years ago, I realized that I wanted to get away from the revolving door of medicine, running 30 people a day through the office and being able to spend time with people, address all their healthcare issues, get to know them as people, and get to know their families. I wanted to get to know the patient and not just the disease process that patient had. And by doing that, it creates a better doctor-patient relationship. If you're as old as we are, you remember Dr. Kildare and Marcus Welby. Well, what I do is more the Marcus Welby. Yes, and we do make house calls to those patients who can't come to the office. If you're chronically ill and you can't get to the office, we do come and see you at your home. And that's all done for a membership fee. My practice does not bill insurance. You need insurance because everyone is one hospitalization away from bankruptcy if they don't have insurance.
That's so true.
So you need insurance for things like labs, x-ray studies, specialty visits, hospitalizations. But for us, it's just a monthly membership fee, and you can pay it all at once a year. You can pay it semi-annually, quarterly, or monthly. And for that fee, you can call us or see us as many times as you want for that year. What makes our practice unique and what makes concierge practices unique as compared to the regular standard practices, concierge practices have a limited number of patients, 300 to 500 patients versus 2,500 to 5,000 patients.
Right.
So you can have longer, more extended office visits. You can have more frequent office visits. We guarantee our patients we will try to get them in same day, but at the latest 24 hours, within 24 hours for an office visit, rather than 6 months later.
Okay, don't give away your whole show because these are things that you're going to explain. These are things you're going to explain in your show.
Right, but we're going to have multiple episodes.
Okay,
Yeah.
So who are going to be, like your guests, who are they going to be?
Our guests are going to be surgeons. We're going to talk about breast cancer. current therapies in cancer treatment. We're going to talk about newer robotic surgeries. We're going to have surgeons on who do robotic surgery. We're going to have allergists on. We're going to have immunologists on. We're going to have all kinds of people on. We're going to have companies on that provide home services that most people in the community don't know about. We're going to have people on from companies that do testing for colon cancer from your blood rather than having to have a colonoscopy if a colonoscopy is contraindicated. We've got a whole list of shows. It's going to be really awesome.
So just so you know, since I know what's going on because I'm here, it's going to really give you the extra knowledge you need to know when you need to pick a doctor, what doctor you need, and what you're going to be in for moving forward, going through some of these things. Everybody, I know that you kind of get nervous when it comes to doctors, especially guys. For some reason, we don't go to doctors as much. Even if we can afford it or have insurance, we avoid going. I'm a prime violator, just saying. But
yeah, and we don't have a check engine light like on your car.
That's true.
Right?
Well, but don't, and I'm sure you're going to teach us some of the things that we need to look out for.
We are.
Okay? Because the truth of the matter is, my heart attack was predicted 10 weeks prior to having my heart attack by a concierge doctor. Okay? Ironically enough, learning the things that I learned was the reason that when I had my strokes, I was in a hospital within 20 minutes and got a TPA shot. I guess this is the miracle drug for stroke people. I'm one of those people. But it is so important to have the knowledge prior to the incident than waiting for the incident and then to get the knowledge. Doc, I want to thank you for coming on.
Thank you.
Everybody, check them out. Preserve HealthTalks, and we'll give you some more information as we move forward. Have a great day, and we'll be right back.
One more quick thing. I
Okay.
want to tell people how to reach us.
Oh, go ahead.
Okay, you can reach us several ways. We have a YouTube channel
Okay.
where we're going to upload all of these shows.
Okay.
It's Preserve Health MD
Okay.
on YouTube. And you can check us out on our website, preservehealthmd.com, which will direct you back to that YouTube channel if you'd like. Or if you have any questions, you can always call our office at 772-252-1425.
And on top of that, you really, over and above that, you really need to watch the show. Because that's what I have to say.
Watch the show.
Everybody have a great day.
Watch the show. Give us a thumbs
right
up.
back.
We appreciate it.